everybody, this is Tess with ROE Dental Lab, and today I want to talk with you about our large assortment of partial denture offerings. I know sometimes it can be difficult deciding what material to use when, so today we're going to talk about a couple of different scenarios and when you may use what. Now please remember, we are going to talk about partials today, but we are a full service lab, meaning we fabricate everything else in between. Crowns, dentures, fixed full arch guards, you name it, we do it. Now, let's dive into partial dentures. Let's first kick off with a partial offering that our patients all know, love, and ask about. I want the tissue colored partial, I want the flexible partial. We know a lot of patients come in specifically asking for a flexible partial. So who are candidates for these type of partial dentures? When we're making a flexible partial, we're using it on patients who are taking care of their teeth. We're hoping that when we make this final flexible partial denture, it's going to be their final restoration with no additions later on. Now, while we can add teeth later on to flexible partials here at ROE, I do want to talk a little bit about how metal frameworks can be easier or more cost-effective when it comes to having to add teeth later on. And with that being said, we have two different metal framework offerings here at ROE. Both of these metal framework options are fabricated using SLM technology or selective laser melting. Many labs can fabricate in a variety of different ways, but here at ROE, we chose selective laser melting over traditional casting as it's more accurate, faster, lighter weight, and better restorations. Better fitting restorations, really. Let's talk a little bit about the chrome cobalt. It's going to be a great everyday offering. It has a high shine, it's beautiful, durable, strong, excellent framework option for you and your patient. And in the scenarios where your patient maybe is a little bit older and wants a lighter weight partial or has a metal sensitivity, we have our titanium partial offering. It's also going to be a little less thermoconductive than the chrome, so it is a great secondary choice for your patient. Now, I will be honest with you, I couldn't really gain my appreciation for metal frameworks until I started here at ROE and understood how much easier it is to add a tooth onto a metal frame than it is a flexible partial. So for those patients who present to us that are a little bit older, we know they're going to be losing more teeth over time, unfortunately, or maybe some underlying health conditions may point to the loss of a few more teeth later on. A framework's going to be a great solution for them. Now we know that what we say isn't always the last word, so if you have those patients who are like, hey, I really want a flexible partial, but you know a metal frame may be a better choice for them, we can meet you guys both in the middle with our hybrid. So what that is your choice of metal frame, either chromium cobalt or titanium, and then instead of adding acrylic onto that with teeth, we then go ahead and add a flexible material onto that where the acrylic would normally be. So it's a little bit of compromise and best of both worlds. Now, we touched on allergies a little bit earlier. Let's say you do have a patient with a metal allergy who's looking for a more affordable partial denture option. We do have our Acetal, which is a resin-based partial that we can fabricate for your patient with tooth colored class. So again, if they come in with an allergy to certain plastics or metals, that is another offering we have. The last one I want to talk about is going to be our acrylic partial denture. Many of us are familiar with acrylic. It's a great affordable baseline partial denture material that can be used if your patient's looking for a cost-effective solution, or very great for those patients who are just having a single tooth extracted and want something temporarily. Since those acrylic partials can have wrought wire clasp, we're not relying 100% on tissue retention. They're excellent for immediate partial patients who are going to get something a little bit higher end. Maybe later on we're going to replace that with a flexible partial or what have you. It is a great option for them. If you want to talk specifics about a certain case or have more questions, please call into our lab directly. Our technicians are there to help and support you with your questions. And don't forget, if you need a crown made underneath a partial case you send to us, or a guard, a denture, you name it, we do it here at ROE. We are a full service lab. Thank you so much for tuning in, and we look forward to helping you find the right partial denture material for you and your patient.